Okay, we've got about 30 minutes or so. We can take slightly longer if we end up having lots of discussion for questions, comments, observations. So let me just open the floor. And could you please identify yourself before you speak? I think we have microphones to be passed around. We'll take you first and then John. Yeah.
Do I need a microphone? Yeah, a very loud voice.
Well, let's.
It's for the streamers.
Oh, it's really for the people online.
My name is Andrea Mordon, and until I gave birth 3 years ago, I was involved with international drug policy reform. And it seems to me that this region, for me, it can't be, the issue of security and so on, cannot be separated from that famous poppy that, in fact, I was dependent on for 20% of my life. So I'd be really interested in if you could weave in a few, comments about that in the next 20, 30 minutes. Thank you very much. And, particularly about, how much you feel is, could be sorted out to some degree around security in the region. If poppy wasn't an issue. Thank you.
Okay, let's take 3 or 4 questions actually. John Bennett over here on the end. I've identified you for yourself.
Thanks, Wendy. Yeah, John Bennett. I would like to see a little bit more rigorous separation between the anecdotal evidence that shows that communities are concerned about neutrality and impartiality, and the mandate of the organizations that profess to be neutral and impartial. Now, the reason I say this is because I think there's probably the tendency for an internal debate within organizations to be somehow justified on the basis of evidence drawn from communities they serve. And we find, over time, we've found very little rigorous collection of that evidence from communities. And if there has been collection of evidence of opinions from communities, it tends to be ambiguous to some extent. I mean, I've been working in Sudan recently with Wendy and others, and we find there, for instance, that there are communities who are very adamant that security is their foremost concern, and therefore they're almost getting to the point where if you were to ask a leading question, they would say, yes, we feel that the international community ought to be more involved in security measures to protect us. On the other hand, you, for instance, have come up with the, you said in your talk that you arrived in Pakistan, and then the very first question was asked. Oh yes, the community said yes. We are concerned about where your money comes from and who you are, etc. This kind of thing, which suggests that there is also a community perception that neutrality is something of their concern. My problem is with all of this is that precisely because we don't have very much access to communities in these situations, precisely because we are cut off, we may have the tendency to be reinforcing our own opinions by simply reiterating the mantra, so to speak, without necessarily going into those communities and finding evidential type of material which would support the position that we're taking. So I think there needs to be a separation between our own internal debate and the actual perceptions of the communities we serve.
Thank you. Anyone else in this round? Okay, there's a lady back here. Can we move the microphone? And then we'll ask our panelists to comment or respond.
Hi, my name is Aisha. I'm from CARE International. Thank you very much for all your presentations and your comments as well. I really welcome the MSF's stance on neutrality, because something which a lot of agencies, both multi-mandate ones like mine and humanitarian organizations face in our operations in insecure environments. I'm curious to learn about your use of 100% private funding, because that really to me is the core of the issue here, and which demonstrates our our willingness to uphold ourselves against our own humanitarian values. So, with very due respect to the gentleman in the audience about his question on perception, I think yes, we do need to be sensitive to community perception, but equally, as an activist, as a humanitarian practitioner, it's very important for us to challenge ourselves beyond the concern for our perception. So I think it is a mindset change also that we in this sector need to have.
Thank you. Let me ask the presenters to respond if they want to. Nikki, do you want to go first? Are there any of those three that you want to comment on or respond to?
Well, I'll try to respond to the first two. Actually, on the first one, perhaps this is a reflection of the gap here. I mean, while certainly I think anybody who works in Pakistan and Afghanistan is familiar with the drivers of conflict and opium being one of them, I don't think it's one that the majority of humanitarian actors have a great deal of knowledge about. I certainly put myself in that category. And it's not one that there's a lot of linkages between humanitarian programs and in what is largely longer-term development initiative to look at the influence that the opium trade has on livelihoods or exploring alternative livelihood sources. So I think it's one that, I mean, I find the question very difficult to answer because I don't think that linkage is there. I think the fact that that linkage is, in most cases, not there might provide some answers to what you asked. The second question, I have to admit, we cut out for a minute. We had a power outage. But from what I had understood, and the kind of the difference between what is our ideological view about how you'll be perceived and the actual reality of that, I certainly couldn't agree more that there's a need for better evidence and a more systematic look at community perceptions in contexts. And certainly in Pakistan that is the case because here, even more so, again, just at least on my personal experience, that in other contexts that I know, there is quite a significant distance between communities and beneficiaries because of security elements like movement restrictions, people not being out in the field as much as they might be or should be in other contexts, high walls, barriers of mobility both on our side but also on the community side, in particular for women, and it means we don't know our beneficiaries as well as we should. I think there are efforts for that, and for me, actually, the study that Vicky referred to would be an example. So from Aisha's side, I think the effort has been there to look at this from the perspective of a global study that did conduct extensive interviews in a number of countries. And when we hosted the research here in Pakistan, we certainly went out to a lot of the districts in KPK that were going through this very complex emergency security environment to talk to both the communities, but also to the agencies that were implementing about how they determined perceptions and how they responded to it, to pull those together as at least an effort to go beyond anecdotal evidence to see if this was something that operationally people really felt was relevant. So I definitely recommend that as a study to look at. I think the third question was more directed at Reese, so I'll let him answer that one.
Okay, thanks, Vicky. Reese.
Thank you. Yeah, for the first question, I did not totally understand, but I will try maybe just to explain that for Elman, we look at it at one of the people to talk with, because most of the time when you analyze a context, you go for the armed actor and the UN or the army and so on, but we have the tendency to forget all what I will call kind of mafia kind of business, and really able to be aware of what is going on really inside a district in terms of influence, in terms of business, and really try to discuss with those people in order not to be targeted. Because obviously you are going to be witness even without noticing it to some stuff, and you have to be in touch with all the people that could have an influence on your project, basically. That's how we tackle it. Otherwise, we have very little expertise in terms of what does the whole business of poppies has an impact on security, yes or no. I mean, it's one of the resources of the war. That's quite well known by everybody, but I don't know much more. For the evidence, actually, I will challenge that in a sense that I don't think we'll be able to find evidence. Again, it depends. It changes very quickly. And one of my friend explained for the Fatah, for explaining a bit how is the Pashtun community. You say, okay, look, you can work 100 years, you will be fine, they will be very happy. If you make one mistake, you will be out straight away. It changed from one day to the other. It's something very, like, take the float in Pakistan, a region like Sharsada in Peshawar, which is just, unfortunately, a big suicide attack happened this morning in Sharsada. 70 military people have been killed in a suicide attack. We have been working with a team of 15 up to 20 international staff for 2 months in Sharsada, driving around everywhere. Why we have been able to do that? Because it was a very strong natural catastrophe that basically blocked everything, and for a certain time, because the whole dynamic in the region was stopped, it was possible to intervene like this. And the perception was, okay, we need a lot of things now, and whatever it is, we will accept it. And then the perception doesn't matter too much somehow. I mean, it's important, but not too much. But then, when the conflict restarts, and the whole kind, I will call politicization, I mean, that's much more where you need to stand, and the people need to know exactly what you are. And it's definitely a region where they really go quite deep in terms of being sure that you are not lying or trying to hide anything. And I think it's very important to be totally straightforward. And now it's true that security is the first, very first need, but obviously the people, they see doctor when they see us. They know that they are not going to say that they need security first, but it's one of the first needs, maybe even before health. But I guess the only way to work is again to work on the field and to be able to drink tea. I mean, this is the only way. This is the only way to do. I mean, whatever the survey or this perception changed so rapidly that is very difficult to grab and to make analysis and say, okay, it's like this and it's over. For the 100% funding of MSF, I mean, again, this is first of all. MSF can, not all the organizations definitely can do that. MSF has taken some political decision very long time ago to invest in many countries in the world, and we have a very broad donors community. We have 4 million donors, I think, today, which allow us to do that, obviously. But still, we for those contexts, we say this is very important to convince that we are independent and impartial. Why? Because we want it or not, MSF, like other organizations, are perceived as from the West. And we have troops. This is Médecins Sans Frontières, the Belgian section. We have Belgian troops in Kabul, in Kunduz, in Kandahar. You have the French section with troops in Kabul and elsewhere. No, I don't think so. Then you have troops fighting in Afghanistan and linked to Pakistan as well. Then you need to convince this community that you are 100% independent and you are not influenced by anybody. That's the key thing, and the funding is one of them. It's not the only one, but it's one that is very useful to use as much as possible, of course.
Thanks, Vicky.
Sorry, sorry, thanks. I'll just probably respond to your question, John, which is I'm most able to perhaps give some reflections on, and I generally wholeheartedly agree with you that there is clearly a huge, very significant paucity of real credible data on the perceptions that beneficiaries and communities have of humanitarian actors. And I think that's a major concern. At the moment, we, HBD, are undertaking some research on UN integration and the impact that has had on humanitarian space. And one of the things we've been asked to look at in particular is to what degree association with a UN integrated presence or an integrated mission has affected the perception of humanitarian actors amongst communities and beneficiaries. And to date, actually, it's been extremely difficult to find much data on that at all, let alone any evidence to say that there has been an impact on those perceptions or not. And I think that is concerning because humanitarians, as they have increasingly used an argument that association with political strategies undermines their credibility, changes the perceptions of them amongst these communities, these agencies need to be able to demonstrate that, to push back on the arguments that many non-humanitarian actors have given, that there is no real impact of politicization, and that we're kind of, not making it up, but we're overblowing the problem. So I think there's a couple of points there that we need to be a bit more cautious, perhaps, in saying that there is definitely a change in perception that is that emanates from any association with political actors or political strategies. To be a little bit more cautious about that, and try to make more efforts to explain the difficulties in understanding those perceptions, but also try to elicit more proof, more evidence of the argument we're trying to make. Evidence-based advocacy obviously is more effective than the non-evidence-based advocacy. Thanks.
Thanks. What about other comments, questions? I don't think we have any yet from our online audience. Is that right, Malcolm? Okay. So this lady here. Thanks.
Hi, I'm Jennifer McCarthy with CAFOD. I'd like to briefly ask Brice to speak to his comment about, regarding the decreasing levels of trust in NGOs. I think you mentioned KPK in particular in Pakistan. And your comment sort of including faith-based organizations in a list of sort of corrupt and ineffective organizations. Could you please expand on that?
I didn't say that was links between all of those things, but I can explain.
No, but it included in a list with other types of organizations, such as corrupt and ineffective. Thanks.
Okay, let's take a couple more if we have any. Okay, we've got one here and then over here. Oh, we'll be next.
Hi, my name is Catherine Rashad. I'm with the Post-War Reconstruction and Development Unit at the University of York. And my question is for Brice. You spoke about, following on with the previous question, about the lack of trust that communities have in NGOs for a variety of reasons, and how hard MSF had to work to create an independent, personality. Do you find then that you have to distance yourself from coordination with these other NGOs? And if so, what impact do you think that has on the harmonization of humanitarian assistance?
Thank you. And then let's take one more in this round. This gentleman at the front.
Thank you. I'm Shahin Ahmed from Oxfam. Thank you very much for the presentations, and I understand that in short presentations are very difficult to capture every sort of complexity on this issue, but just a couple of comments and then a question. Firstly, just to follow on from the issue of funding, this is something that I've looked at when looking at the issue of access in Afghanistan and Pakistan, and I'm still left quite sort of uncertain about its role. And just to take one sort of simple sort of example, you can have an organization such as ICRC and organizations such as Oxfam actually take money from similar government sources, but actually then have very different experiences in terms of the degree of access that they could have in those kind of contexts. I was interested in, and you made this point, Brice, about progressively greater visibility, and I think that's an interesting challenge for organizations in those two countries in particular. I mean, I know that we've all seen how the INGO community in particular has reduced its visibility in Pakistan. I think particularly after the earthquake, it just became steadily sort of less, and particularly during the when the conflict sort of surged. And it's interesting because, arguably, and I'm actually of that school of thought, that that's potentially quite counterproductive, and in fact in the long term arguably raises the risks that those organizations are trying to fend off. And I think that's something that organizations do actually need to look at, and think not just short term, but also longer term. And then another point that I was interested in, Brice, when you talked about very active networking amongst all actors and not prioritizing other NGOs and UN agencies, etc., but think more local actors. And I'd be interested if you could just elaborate a little bit on what that means practically, and what the possibilities are in that regard for multi-mandated agencies, particularly working in difficult contexts like, say, Balochistan or Fatah. Thank you.
Okay, should we take those three questions? I think most of them were directed at Brice, so we'll let you go first, but then we'll ask Nikki and Vicky if they have any comments to make.
Okay, fine. First of all, for the NGO Perception, again, it's not me that had this perception, but discussing with the people is something that we have seen. It's not the first. I mean, we have seen everywhere where you had something like 25 years of humanitarian operations, Congo, Kivu, many different contexts, actually, where you see what we used to call the famous humanitarian circus. You know, after a while, the NGO concept is so vague. I mean, it's something where you have so many different kind of organization that at the end of the day, the people after a few years, they don't really understand anymore what is it exactly. And that's one of the issue actually, where we think that the people perceive us exactly for what we are, saying just, I'm a humanitarian organization, but for them, it doesn't mean anything anymore almost. I mean, again, when you have organization from a charity organization, from religious group, which are doing a wonderful job, I will explain a bit in Pakistan, to organization doing development, microcredits, emergency organization. We have a scope that is so broad that basically for the common des mortels in French, for the common people, it's very difficult to catch this concept. That's why I think it was interesting for us, not for the sake of just differentiate ourselves and say those are the bad ones, we are the good one, not at all. It's just to do the exercise to say what we are really and to try to not use the term NGO. But it's true that in Pakistan the term NGO has some connotation, also because for them most of the NGO did not deliver always what they were expecting basically. And that's the community saying that, saying, okay, look, we have seen a lot, we all hear this kind of stuff, that we have seen a lot of exploratory mission. Many people came and did some promises and so on, but nothing happened at the end of the day. Then why is going to be different with you? We don't trust you especially. I mean, we have seen like 5 teams doing assessment now. I mean, what are you going to do now? That's why, I mean, I think it's interesting for every organization, not just to satisfy ourselves saying I'm an NGO, I'm humanitarian, but trying really to express and to explain to the community what they do exactly and what they are. For the funding, your question about the funding, again, what I'm saying is not that you should have 100% private funding to intervene in Pakistan or Afghanistan. It's one of the tools we use. I mean, we have the luck to have a private funding, and we use it as much as we can because it's, but totally, I mean, RCRC is a 100% government-funded organization, and they do have access in most of the places. True, but again, it's an organization should take whatever is possible in its hand to be able just to stick to what they are, and also to explain to the community that they are independent because, and to find some. But funding is one of them. I mean, it could be something else. The progressive visibility, again, it goes that, but that's why it was very challenging. Challenging. We were used, let's say, more classical conflict, like in Africa. You just arrive with your white Land Cruiser, and then you have your stickers, and you say, "I'm the nice doctor going to care for you," and here you should respect this white car and all the people inside and everything. And that's obvious. I mean, it works pretty well for the last 25 years, even more. But in Pakistan, especially, we are very we have been very challenged about that. Again, because the committee was not trusting us, and we had to show to deliver first. Basically, we say, okay, we have to deliver first, not talking to, but deliver first. What can we do, and then to increase the visibility. Because obviously we have to show, in terms of security, I believe it's very important. You cannot stay with a low-profile kind of setup for a very long time. You have step by step to increase and to show externally what you are and to have this visibility around. For the local interlocutor, yeah. The float again, but Sharsada was an example, but we have done that in many other districts in Pakistan. At the early stage with the float, we were feeling that we were already with a lot of operation in KPK with something like for the three sections, we were 60 international staff, 800 national employees, something like that. Then we respond to the float, and very quickly we say, okay, look, actually if we want to move around, we have to directly coordinate with most of the, if you want, the humanitarian branch of the Islamic groups. A lot of religious organizations in Pakistan that are doing a great job and are not represented at all in the UN system mostly. And then you need to coordinate with them on the ground directly. Then we really tell the team, we actually put somebody in charge of that, discussing with all the local Pakistani NGO to look at who is delivering what and to explain what MSF was going to do. And this is not very good, but in most of the cases in Pakistan, we were pretty much alone for at least 6 weeks before to see the other international NGO to come. Then during that time, we were able really to coordinate with those local organizations. It helped us a lot after. Actually, the float was really the tipping point to really increase our visibility everywhere. We say, okay, now full identification for all the employees, for everybody, all the time. Yeah.
Thanks. Nikki, do you want to comment on anything?
Yeah, no, I mean, I think Brice has very clearly explained, and of course we see here in Pakistan very clearly MSF's efforts and also that of certain other actors to focus on identity very strongly. As Brice was saying, the term NGO in certain areas is considered a bad word, and we see increasingly NGOs and other humanitarian actors trying to define their identity more specifically in terms of the services they deliver, what they're offering the population, and making it more clear in their communications with what they stand for, and with a variety of tools, indeed, because everybody has slightly different tools at their disposal. I think with the question of identity, what's quite interesting from our perspective, and just maybe to get into the last question we heard, comes along, I think, the issue of distinction. And what we have seen in Afghanistan and in Pakistan, I think, is that certain humanitarian actors want to choose to distinguish themselves from others. And again, this is, I think, because they very practically, from a security perspective, from an operational perspective, feel the need to do that at least visibly. And the question was, how does that affect the harmonization, I think, of the humanitarian system? I think the answer is that we're not striving for harmonization. In a country like Pakistan and Afghanistan, as OCHA, for example, we're quite careful not to speak on behalf of the whole humanitarian community, or even to use things like logos, or when we have situation reports, not to put in there references to, for example, MSF or ICRC, who don't necessarily want to be perceived as part of the overall humanitarian effort. They want to be perceived as being very strongly just through their own identity, working on the ground, on their own terms, with their own tools. I haven't experienced here that in any way undermines the coordination. So coordination rather than harmonization, I think, because of very good bilateral relationships and very good information exchange between actors, that's entirely possible and indeed understandable in a context like the one we're in here. The UN, even regardless of how we position ourselves in country and how we operate on the ground in the country, is always going to have a very different perception and risk profile to communities, to armed groups, simply because of what it represents, simply because of its political instruments, because of what the UN Security Council might say one day, or the UN Human Rights Council. And we understand that that's our risk profile. We don't want that to reflect negatively on others. So just on the coordination aspect, we haven't seen the identities coming out more strongly, and sometimes the distinction that leads to being an operational problem.
Thanks, Nikki. I'm going to hand over to Vicky briefly, and then we've got one, I think, online question or comment. We're over time a little bit. I'm suggesting we take another 5 minutes. Afterwards, we invite you all to join us for sandwiches and refreshments. I'm sorry you can't, Nikki, and neither can the online participants, but at least we can offer you that so we can continue our discussion there. Vicky.
I don't really have anything to add. I think it was very succinctly answered by both Nikki and Bree, so maybe
Okay.
to the online questions.
Right. Malcolm?
Sure. This is Clive Bacon from World Vision, and he's the Programme Development and Effectiveness Director for the region, and it includes Pakistan and Afghanistan. His question is, we're looking to increasingly work through local partners, national NGOs, than directly implementing programmes. These partners obviously have their own identities, as well as their own alignments with different actors in the country. What do you see as the advantages and disadvantages of taking such an approach?
Okay. Could you hear that, Nikki?
Not entirely. The question is, what are the advantages and disadvantages of working through local partners?
Yes.
Yeah.
Given, yeah, the speaker is from World Vision and saying that increasingly they're working through these local actors.
Okay, well, that's interesting, because I guess I would pose the question back to World Vision, given our other panelists, MSF is not an actor that works through local partners. That the question really is for those agencies. It's definitely the more common operational model. For all of the UN agencies, it's the case that they work through partners, sometimes international and sometimes national. And I would say for the majority of the INGOs operating in Pakistan, the implementation is done through national partners with a lot of technical, managerial, and of course financial support from the international NGOs. In terms of the advantages and disadvantages, I mean, I'd actually at this stage love to hear from the audience, from agencies like Oxfam, like CARE, like CAFOD, how they see this on the ground. Of course, some of the problems that we were referring to earlier, for example, Mrs. comments on access for nationals, not for internationals, are completely different kettle of fish when we're looking at a national actor who won't necessarily have access problems, particularly from the area, who in terms of assessing perceptions, assessing security risks, has some very clear advantages to internationals moving into a new area. Brice might want to give some more details on why one of the tools that he mentioned that MSF uses is to bring in international staff and the benefits that brings, both in terms of independence and ability to advocate perhaps more freely than somebody who's under local pressures from various sides would be able to, and also in terms of simple monitoring and technical expertise that could bring in. But I'd really like to see if somebody from the audience has some comments on that in terms of direct experience, given that OCHA is not an operational actor.
Well, maybe I'll just refer that back to the audience first before I let Brice comment. Does anyone want to offer a perspective on that? Maybe in terms of the implications. I mean, remote management and remote monitoring are terms that are often used in that sort of context where you're working through national. Are they partners or are they implementers? What sort of relationship do you have with those actors? Yes.
Yes, again from CARE. All CARE, for example, in CARE Pakistan, if you look at our floods response as well as our earthquake response, it was entirely through working with local partners. So in terms of monitoring and evaluation, it does pose a lot of challenges, particularly when the same local partners are, if you want for another word, we're in a way competing with a lot of INGOs who are partnering with the same organization. So program quality, monitoring evaluation is that much harder. In terms of why we do that, essentially it's considered we've taken a much less visibility profile, so we're a lot more risk averse than perhaps MSF, and therefore we do have a policy where we don't place international staff in high risk areas in the field actually. So it's a very different operating model, and as I said, it comes with all its challenges, but that's the benefits of that. On the other hand, is that we are able to boost local capacity and bring more resources to a lot of the local organizations who are in fact not represented in the UN coordination system. So in a way, we're kind of challenging resources through those local organizations, and in the long run, it helps to boost national capacity.
Thanks. Brice.
Yeah. First of all, actually MSF do work with the local partners, especially again for project like HIV project, like mental health, more long-term project, and I think it's obviously a very good thing to work with local organization for this kind of project. Now, what I've seen on the field is most of the time for emergency, there is a complete underestimation of the capacity of the local organization to absorb the funding of an emergency. Meaning that you work through local partners that you cannot really monitor, and you send them hundreds of thousands of dollars, and you don't realize exactly what kind of logistic capacity in terms of truck, distribution, everything. And we have seen pretty bad thing on the field, especially in terms of distribution, and how it's very tricky and difficult to organize distribution in a right way. In Pakistan also is a big challenge, and actually where you need to have a direct monitoring of what is distributed and also how, because sometimes bad distribution will even increase the insecurity for the community, because when you just throw a truck in the middle of a camp, then you will see what will happen. It did happen in Pakistan. Then I will very much challenge actually the approach to go through, to work with local partner, yes, but to go through local partner for an emergency situation, definitely. Now, for a conflict zone, we did so, for instance, for SWAT at the beginning with the SWAT Doctor Society, and then step by step. But we worked together. I mean, it was a problem of access, obviously, to this area. In Somalia also, we worked not with local partners, but only with national staff, because it's impossible to stay there. There are few contexts where we do this kind of thing. But it's always very very difficult, and you put a huge burn on the national team for obvious reasons, and you should try to avoid as much as possible. But it's always a question of context and to balance the risks.
Okay, Vicky, do you want to have the last word, because I think we're going to have to wrap up, or did you have? Okay.
Yeah, not the last word.
Okay, the penultimate word, and then we'll, if everybody's happy, to carry on for 2 more minutes. Okay.
No, well, I just really wanted to add to this particular question about working with or through national implementing partners, and I think a number of you raise issues or the disadvantages or potential risks for the international agency, whether it's UN or an international NGO working in this way. And obviously, as Wendy said, increasingly there is this idea of remote management, particularly in places like Pakistan, Afghanistan, Yemen, etc., where the ability of international actors to physically be on the ground in places to deliver assistance is much diminished by the security situation. And there's perhaps 2 points I wanted to pick up on. First, the lady from CARE, you mentioned that perhaps this relationship is an opportunity to boost national capacity, and obviously that would seem to be true, but conversely there's also the risk that you're overwhelming national capacity, and I think we've seen in recent years in a couple of cases a rush by international agencies in new or rapidly deteriorating crises to focus on 1, 2 or a small number of national actors. For example, Red Crescent societies in Yemen. The Red Crescent Society there was one of the few actors who had access to the conflict zone to the north of the country, and most of the international actors wanted to use them to be able to as an implementing partner. And obviously that raises quite serious concerns about the ability of them to deliver, pressure on them to accept funding and accept these partnerships, as well as the opportunity to boost their capacity in that respect. But then secondly, obviously in terms of remote management, we are using that as a tool because we physically as international actors can't be there. But what does that mean? It's not a secure situation by any means. The risk may be slightly higher to an international, but there's still obviously a serious risk to most people in that environment, particularly in places like Afghanistan and Pakistan, Yemen and others. So you're effectively transferring a heightened security risk to national actors. And your ability as an international agency using them to provide them with security, obviously I would imagine not being an operational agency, is also not high. So I think those are 2 concerns I would add to those thoughts.
Okay, thanks very much, Vicky. Just one last question, if we can keep it brief, and then any responses also brief, that would be great.
I'll try and keep it brief. Nigel Young, Head of Emergencies at Merlin, recently appointed. So last year I was working for another agency in Pakistan and the floods, and I was going to agree with Vicky on the transfer of risks issue and bring that back to the Pakistan situation in particular, where politically, through donors, a lot of pressure was put on agencies and by inference their partners for a high profile of those nationalities and how that was given. And
to come back to the idea of although I agree that there is a lack of good data to prove on community perceptions, that it's not always those community perceptions that lead to violence against agencies. So just to come back to the point of donor governments and working with donor governments to reduce that pressure for visibility in certain circumstances, and to think again a little bit about what that means in how we work and how we relate to donors.
Thanks very much. I mean, I'm going to actually take that, Nigel, as a comment as opposed to a query that has to be responded to, because we're running out of time. But I wanted to thank all of our presenters, and Nikki especially, for allowing yourself to be video conferenced in. It must be quite late your time. And also to our online participants for joining us